Hi, this is Terry QT with Deep Sea Foundation. I'm very honored today to have my own physical therapist, Leslie Droddy. And Leslie did a lot of my physical therapy. Well, she did all my physical therapy.
Pretty much.
Yeah, pretty much. Both through my mastectomy and through my deep flap breast reconstruction. So, Leslie, I want to talk to you. Oh, and she is a certified lymphedema therapist. So, I think I want to preclude this interview, Leslie, by just letting the viewers know that when you are searching for a physical therapist after your breast reconstruction or after your mastectomy, it's very important to look for a certified lymphedema therapist. And can you give us the name of the website? I know that I've written about it in a blog that we did.
Yes, it's the best starting point is www.clt-lana.org.
Great. So that's a good resource to find one in your area, because I know you can look throughout the country.
You can.
Okay. All right. So we're going to do a couple of videos this evening. And what I'd like to do, Leslie, is just start out with a very generic question here. Tell us what lymphedema is in relationship to breast cancer and breast reconstruction.
Okay. Well, it's swelling, and it's swelling that you get because part of your lymphatic system is damaged. So in terms of its relationship to breast cancer, that usually occurs if you have any type of procedure where you're going to get lymph nodes removed or have radiation.
Okay. What about just sentinel lymph node? Is there a difference between, because I know some women have multiple lymph nodes taken out and men, but for me it was just the sentinel.
Right. So there are certain people who can develop lymphedema even with just the sentinel node removed, but the fewer lymph nodes that are taken, the less likely you're going to develop that. And really, most breast cancer patients don't get lymphedema. I see the ones that do, so I feel like I see a lot of them, but as far as the whole population of people diagnosed with breast cancer and undergoing treatment, it's a smaller percentage of people who actually develop the condition. So
when does it happen?
That's a really good question. It can happen really at any time. I have seen people who develop lymphedema right away, and immediately post-op, you can't determine whether or not you have lymphedema because you're going to have swelling after a surgical procedure. That's the body's normal part of healing itself. But it can start from that point, or I've seen patients who had it onset 5 years later.
Yeah, I've heard that, and I've never experienced it. I'm 4 years out, but I got to tell you, I talked to enough women and physicians too that tell me that. So yeah, we need to be aware of that. So that being said, let's move into what signs should we look for if you've had breast cancer and you've had breast surgery, you've had breast reconstruction. What signs should you look for that would indicate that you may have lymphedema?
Well, you'd think you'd look for swelling, right?
Right.
That's what you think you'd look for. And you do. But most women at very, very early onset of lymphedema, they won't see swelling, but they'll feel kind of a tightness, almost like there's a rubber band around their upper arm. I hear that
because
a lot.
Of the pressure that the fluid, okay, that makes sense.
So the fluid can start building before you see a size difference in your extremities. But I hear that a lot. And then of course, you might feel like, oh, my ring's a little tighter today. Well, we all feel that here in Arizona, at least in the summer.
Yeah.
But if you're feeling it at odd times, or you're feeling like it's a little worse than normal, or if that's not a typical symptom for you, and you start to feel like watches or rings are tighter, that should trigger you to go, ooh, is something going on here? But I, believe it or not, I hear that people feel this tightness here. That's the first symptom, and they usually ignore it. So my advice is, I think I told you that on your first appointment. If you start to feel something like this, don't ignore it. Come see me right away. Because the sooner you have symptoms, then the sooner you seek treatment, the more manageable it is, and you can keep it at a minimum.
Okay. Because lymphedema is not a curable symptom. It's not a disease. It is a symptom. It's not curable, but manageable. Is that correct?
Generally speaking, that's correct.
Okay. So next question, real quick. Are there different stages of lymphedema?
There are.
Okay.
There are, and really, to most people, the particular stage isn't important. It's important in our clinical documentation, but
Sure.
basically, what do you as the patient care about? Is it mild? Is it moderate? Is it severe?
And that's documented through your measurement.
Mm-hmm.
Each time you come in and do the treatment.
Yes.
Yeah, because I do remember my first trip in, you doing all the measurements.
It did. Mm-hmm.
And each subsequent trip.
Yes.
Yeah.
Well, not
Okay.
every visit, but yes. Every trip that you went on, we did measure when you came back.
Right.
So mild or minimal would be 0 to 20% larger than your other arm. Moderate would be between 20 and 39%, and then severe would be above 40 or above.
That's good to know those numbers. Yeah. Okay. All right, that was some good initial information on lymphedema. Thank you.
Thank you.
It's great to have you here.